Today, it's a great pleasure of speaking to Professor Christoph Wanner, who is the new president of the ERA. And I was quite keen to start off, Professor, to pick up on the fact that the ERA has changed its name. Does this mean there's a change in the mindset of the society and a change in the direction of what the society is looking at?
Not at all. Our members are very well aware that we are still the ERA-EDTA, as we have been this for a very long 50 years of history. But in modern times, for external communication, to communicate with other societies, the ERA is a shorter, concise, communicable abbreviation of the European Renal Association.
So what do you think the role of the ERA? It's always been a very big society in Europe. What's the main role of the ERA and the vision of the ERA?
We have an umbrella function for all societies in Europe. We have so many countries, and in some countries even two associations or societies, and there is clearly a need to speak with one voice to politicians, sometimes to lay people when we talk about awareness and implementation of new treatments and guidelines. And this umbrella function in terms of education, membership and collaboration is very important. And moreover, we have a registry for all patients in Europe to show how they are treated and how the treatments actually in Europe are implemented in the various countries.
That's really interesting. I wonder if you could tell us more about the registry basis of the ERA, because certainly there's a lot of data that could be collected on renal patients because of such a wide range of conditions.
The registry is a voluntary group of epidemiologists, actually which we support, based in Amsterdam, and they collect from every country in Europe data which the various nations collect for different reasons. And therefore, some registry in Europe are strong, are collecting dense data sets. Others are not so well supported, but have an overview of their end-stage kidney disease populations mainly. It's a registry for dialysis patients and transplantation. It's not a registry for chronic kidney disease, but we want to build this up in the future. So we collect from the 200,000 patients our reach out in the moment is in Europe, data sets on an annual basis. We do the report and we can give this back to every country in Europe for comparison and also for supporting patients when we reach out with these registry to politicians.
Renal care is very much a multidisciplinary team. Is the ERA basically focused on nephrologists, or would it be a good society for, say, surgeons, radiologists, perhaps dialysis technicians and nurses to be involved in?
In essence, we are open to all other specialists. I must say that we are really focused on the moment on nephrology, but with the interventional nephrology we want to expand with the hands-on courses. We need the support of the other societies. In essence, they already can become members today, but we had no special advertisement program. Collaboration to other associations and societies is really keen.
So nephrology certainly has changed over the last 10 years, and in the US particularly, the input of interventional nephrologists has become a much bigger aspect of nephrology. Do you think there's a role for this in Europe?
We in Europe were always different from the US, and we had more components of interventional nephrology embedded in our field of nephrology. I think it's very important. We should even expand this because the younger generation is appreciating interventional work, and we were pretty good with vascular access, renal biopsy, and placing catheters. So, but we need to defend this for the next generation, which is really keen to be involved in to not only geriatric aspects or conventional medicine, personalized medicine, or speaking only to patient, but also doing some interventions.
It's really encouraging to hear that, you know, there's a focus on younger people coming into the speciality and encouraging people to pick nephrology and pick dialysis related and transplant related careers. What are the specific opportunities that of joining ERA that would give to a young nephrologist or a young surgeon perhaps?
I think the main aspects we have learned is really education. And we use our Congress, even in the times of the pandemic, we could implement hands-on courses. We learn new technology, especially these hands-on courses to learn shunt sonography or vascular access placements, catheters can really be educated through this program. And we have started or expanded this, even collaborating to other associations and societies, for example, the Vascular Access Society. And there is a fruitful collaboration. I personally, I like this education to our membership and collaborating to other societies to expanding these programs.
Can I ask a personal question? What is your main aspiration as president? What do you want to leave as your legacy when you finish as president from ERA?
To reach out to all members, so expand membership, and collaborate with the national presidents of all the countries in Europe. Education is key. We had a very strong focus on research in the past. Myself, I'm a clinician scientist. Research is important, but during the time of pandemic and with the new generation, we need both. We need a really strong educational program, and I'm focused on this to attract the next generation, which is a bit more different than the past generation.
Certainly from my experience as secretary of the Vascular Access Society, we've had a very good relationship, and the workshop at the recent Congress was excellent. Just as a final question, perhaps, can I pose it to you that the word Europe is a rapidly changing concept now? And as the European Renal Association, how do we feel that we extend beyond Europe, especially from my point of view, being in Britain?
We kept the word renal. This has a huge tradition in UK. We do not abandon UK. So UK is fully embedded in our ERA association. We have elected a new councillors from UK just 4 weeks ago, Albert Ong, and to keep the connection to UK. And beyond Europe, we have a huge interest even to Eastern Europe, Central Eastern Europe and beyond. Many people from the Asian countries or the countries bordering the Mediterranean Sea come to our Congress and are members. So actually that's the interest in the strong program we have in Europe. So please don't separate UK. It's still in the middle of our European Renal Association.
Thank you very much. And that special relationship, I hope, can carry on. It's been a great pleasure talking to you today, and I wish you well with what is an excellent society, and I look forward to further collaborations with the ERA. Thank you very much.
Thank you.